So this is going to be the last lecture of this series for anatomy physiology, and we're going to go over the cardiovascular system, dealing more with the blood vessels and circulation. So as we're going through this, basically, again, the topics we want to do is we want to talk about the structure of the blood vessels, all the components as we've talked about before, the physiology of how the body circulates blood, how it regulates itself. We're going to talk about the blood vessels itself, and that's going to be about it for this. Again, all these things will be more intense in the actual course. So as far as when we look at through the blood, basically we want to track it from one point in the body all the way back to the body where it starts. And that's where I want you guys to be able to stay. So if I gave you a location, say the hand, what is the process of flow from the blood, and be able to describe that to me. And that's realistically what we're going to be looking at. So the arteries will go down to arterioles from a larger vessel, keeps getting smaller and smaller and smaller as it goes out to these surface areas, or as it goes out to organs and bones and everything like that, and gets into these very tiny areas where eventually called these capillary beds. And the capillary beds are so small that it's very easy for oxygen, carbon dioxide, waste products, nutrients to diffuse across this site. And that's what we call the chemical or gas exchange. And so that's down to its most smallest form. Everything comes out, does exchange. Waste products, CO2, then merge into the capillaries, and then the capillaries then feed to venules. Like arterioles on the one side, it's venules on the other side, and then venules will eventually go larger and larger, larger into larger veins until we hit the back into the heart. So let's talk about the structure of the blood vessels that are out there. So looking at this picture, it's going to show an artery and a vein, and just for purposes, when we talk about the body, anytime we have an artery, which we're going to see here, and a vein, which we see here, there's always an associated nerve with it. So artery, vein, and nerve always flow together. And as I'm looking in this picture, I can't really see, but there's a good chance that we're actually looking at nerve right in here in this area. So everywhere you find an artery, a vein, there's usually a nerve. This could be something down here as well, but I'm more thinking that when we're looking at it, that this is actually the nerve components right in this area. So anyways, talking about blood vessels, you can see the difference when we're talking about the artery. Look how thick the artery is versus the vein. So again, the artery basically is what helps to push blood out. It contracts. This can contract, can dilate. This helps adjust our blood pressure. There's baroreceptors that are all part of this. And so when we look at this artery, there's three components that are involved in building it. There's the tuna externa. So this one is really easy. Tunica externa, and I do want you to know these names. Tunica externa, obviously externum, the external area. So we're talking about this region here. So a more distinct layer on the outside is protective that comes through. The tunica media, again, this bigger area in here, and this is more muscular based. It's a smooth muscle, again, because this is part of the autonomic nervous system that we don't regulate, the body automatically regulates. So this is the muscular component. And then the tunica interna, which is the small layer of epithelial cells that are basically smooth around the area, and the blood flows through here. So those are the three layers. I do want you to know those. And as we come through the tunica interia, again, I talked about these layers, this most inner layer, this endothelial lining, and it's very elastic. This whole area is very elastic as far as the arteries are concerned, so it can expand and contract. If you were to cut across this, straight across, this muscle would just contract completely down and help shut off the bleeding on there. Vice versa, when we look over at the vein is much smaller. The muscle is smaller. Veins are basically to take blood away, and because there's really not a lot of muscle to them and we don't have a lot of expansion on them, they'll have a lot of vein valves and other things that help protect, and so we'll kind of talk about that itself. So as we're looking at here, and again, we look side by side in these areas, you can see that significant difference of the thickness of the walls, and then how big the veins are. The veins are basically carrying a lot of blood back, so they're going to be usually larger in there, and it depends on the size than the arteries. And they can compress really easy because they don't have that muscle. So we can compress veins down much easier than we can arteries. All right, so I kind of described all this here, Sue. So the other aspect we're looking at is the elastic aspect of these. We can get an artery to expand quite a bit if it can dilate, and it can go up to 2.5 centimeters in some areas, some of the larger vessels, so we can get very big and dilated, and it can constrict down to allowing almost no blood flow out as well. So they have a lot of ability to contract and relax, and again, all this is going to be based on the autonomic nervous system and control from baroreceptors, pressure receptors, and what we need from the body as far as maintaining blood pressure and cooling and everything else that's going to go. So they're very elastic, very muscular, and then they break down to the smallest areas of the arterioles. That's pretty much what we need to know about the layers. Again, knowing the names of each of the layers of the arteries, the 3 layers, and then their ability to be much more muscular. Now, as those go down from artery, from the aorta going out into arteries, arterioles, and down to the capillary bed, excuse me, down to the capillary beds. Again, right here, we're looking at an arteriole. So this is going down the small area, and that's going to feed into the capillary beds. So that's going to come down in here, and then as it crosses across these capillary beds, there's small areas, and that's where it allows for gas exchange. And then this blood is going to go up and crosses the other side and goes into the venule, and then the venule out into the vein. So here it's just kind of a look of the flow and what the body does. I don't need you to know too much about this here, but again, there's a smooth band of muscle that basically comes and wraps around there, and it allows the flow into the capillary beds. This is important only for us knowing when we're looking for cap refill and things like that, of where our blood supply is coming in and what's being controlled from there. Other than that, that's going to be where our gas exchange is going to occur. I'm going to keep this in the most simple formats. Once we've crossed that, then it's going to go into the venule. The venule then is going to come up, and it's going to go into veins. Veins are going to get bigger and bigger and bigger. These will expand as we get more blood flow into those, and it'll eventually go up into the vena cava. In the vena cava here, the superior vena cava and the inferior vena cava. And here, and then the vena cava is going to dump right into here, which is going to be your right atrium, and that's the flow back to the heart. So as we go up into larger and larger veins, the tunica externa, which is the outside portion, gets thicker and thicker as we get larger and larger, and it's protecting itself. But again, that thin layer of muscle. And how this basically works is because the veins don't really have muscles and they're very thin walls, it's just got an area, it doesn't really be able to pump. Like the arteries can pump and push a lot of areas, the veins don't. They're just carrying back. So it's hard to become overcome that gravity. So there's smaller venules and they keep going into veins. Well, how does that get pumped then back to the system? Well, besides the artery pushing that force down and getting force up, the other aspect is as we constrict our muscles. As our muscles move, they'll actually constrict as our as our muscles constrict and expand, they're going to compress that vein. And then as it compresses, it's going to push that blood up. Now, blood can only travel one way in veins. So here's the flow coming up. So from these small venules up into the veins, and it's going to get into larger and larger veins, and it's going to be flowing up. Well, what keeps it from flowing in this direction? Well, what we have is we have valves. So here is where the valves set up. And you probably can't see that color as well, so I'm going to switch over to a different color here. But specifically, you have valves right here. And what that does is they basically are like the semilunar valves. So as the blood comes up through the valve up into the area, when the muscle relaxes and allows blood flow to come back, it'll come up against these valves and those valves will close. And then as you compress again, it continues to go up and it goes up through the next set of valves, which are up on the superior aspect. So it'll keep pushing up. And once it goes past this valve into this area here, it will stay there, and if it comes back and relaxes, it pushes that valve closed. So that blood continually moves up in a cycle, and that's how it comes up as that muscle compresses and it folds and it just pushes those layers up. So let's talk about the circulatory physiology. Now, one other important aspect you're going to hear, especially dealing with medics who are doing this, is about those valves, is when we're doing IVs, and we'll talk about IVs later. But as you're doing IVs, you'll come up against those valves sometimes. Once you've got the needle in place and you're threading the catheter, that catheter can push right up against those valves, and you're actually getting no flow into that catheter. And so there's certain things we do where we can call floating the valves and things like that. So we'll talk about that as well. But it's important knowing those anatomy of everything, so where you're at and where valves are most likely going to be seen, so it helps you place with your IV placement. So again, what we're going to do is we're going to be a continual flow, a standard cardiac output, and it's going to be flowing out through the body. What's going to be the aspect of how our flow goes is the pressure or the resistance that we have. And the least resistance, the least flow we have. The more resistance, the more flow. And that goes back to that Frank Starling principle, which is another thing I really want you guys to understand there, and do know that, is basically, again, the bigger the push against, the bigger the contraction. The bigger the stretch, the bigger contraction. So we have to have so much of resistance or pressure to push against to keep our flow. So that's all going to be related in there. Again, our blood can't be compressed, so it's going to be flowing in an area. It's always going to flow, as with water does, from the area of high pressure to low pressure, and that's going to just be pushing and out into the system. So if we look at this here, we have our systolic pressure, which is going to be our contraction area, and our diastolic is going to be our relaxation phase. So what is the pressure in the arteries during that high pressure area? How much pressure is coming into those? Whereas our diastolic is when the heart is relaxing and refilling. We're talking more about the ventricles. What is that resting pressure? So those are going to be able to tell, and that's getting our blood pressure. These are going to be very important because we need to know how those arteries, how those veins are doing. Can there be any injuries with it? Especially when we're dealing with people with strokes and high blood pressure, someone who's been sitting at 190 over 110, not only is that putting a high amount of pressure onto that vessel, it's not allowing it to fully relax either. And so that can cause injury to the vessel, which can cause either bleeding, kind of a breakthrough of bleeding, or injury and damage interiorly, which can cause clotting, and that can cause stroke. So all these things are going to be greatly important, and understanding why we do the things we do and why, based on certain vitals, we're more susceptible for injuries and how we can predict. So all different aspects that we need to know. So as we're going through and we're pumping blood through the vessels, usually we're smooth, nice flow, and able to travel pretty easy. But because we do have different things that can be developed, we can have smokers that can develop plaques. We can have atherosclerosis basically is forming. We can have injury to vessels that cause clotting. We can have plaques, cholesterol plaques being deposited on the wall. All these things are going to decrease our amount of flow. We can also have calcification of the artery walls themselves that don't allow the artery to actually compress. It can give us false levels of BP, especially when we're dealing in the legs with calcified arteries. So a lot of different things that can come and affect those flows. And this is another important aspect that we're doing. One of the most disgusting things I ever did was I actually did a vena draw on a patient and had a fat globule actually enter out of my catheter into the blood tube. So you can see a lot of different things out there that's going to affect the flow, and we just really have to be able to see what's going on when we are checking that. So when we're looking at blood pressures, we're understanding what else is going on and trying to get as much information as possible that's out there. So again, we're going to check our systolic, and as we know, if you give me a pressure of 120 over 80, I'm going to say, okay, are you brand new? I always laugh with the EMT students on that. So again, it's finding what the correct blood pressure is, checking the pulse, seeing the rate, rhythm, strength of contraction. All those things are going to be important as predicting what's going on, what type of injuries we're going to see, and what that pressure is. And as we look through, as we're coming through with this picture here, as we get outside and down to the arterioles, our pressure is going to be dropping. We need it to drop to allow that flow to come in, and it's going to come out and go into venial. That's the big aspect that I really want you to go from as we're dealing with the blood vessels. Now, as far as regulation, basically the body regulates itself with this. It needs to get tissue perfusion, and those receptors in the body, if we talked about the nerves that are going around telling it, it tells us how much oxygen needs we have, our nutrient needs, and all those are going to determine on how we're flowing. Are we going to sit at a normal rate? Are we going to increase blood pressure? Are we going to increase heart rate? So the different aspects that keep us from there is the cardiac output, the peripheral resistance, and where our blood pressure is. So what we have to do is we have to be able to increase those to meet the demand of whatever our body needs. Are we in an area where we're bleeding out to an area and we need to get more pressure into the area? Are we area when we have an infection and so we need more blood flow, so our blood vessels dilate, and so our pressure technically drops, but we need to get more out there. And so it's our system of basically reading baroreceptors that are placed throughout on capillaries, on muscles, on arteries, are all going to give feedback to the brain and let us know where we're at. So if we have some type of changes, any type of changes, as we'll see right in here, that can affect the body, that's going to send a message up to the brain, and it's going to send to the brain and also to the endocrine system. Because what do we have right here? See if you guys can remember this one. Should have that. The adrenal gland. And the adrenal gland is going to affect responses by secreting hormones. The two main ones, epi and norepinephrine, which is going to affect our blood pressure, our heart rate with inotropic, chronotropic, and dromotropic effects. Our brain is also going to basically help to work with the blood pressure by working on the arteries themselves to contract or constrict as we need to basically affect our blood pressure and our flow. So all these things are going to be going, and it's a continual cycle of our body just keeping itself regulated. So once we get that stimulation to the heart, so we need increased levels of output because our blood pressure is low. So we increase those levels. Well, that's going to cause a couple of different things. It's going to affect our pH levels. It's going to affect our breathing rates. Everything is all controlled and working together. So all aspects are going to be responding, and it's how we continue to monitor. once we get our levels back to where we need to be, then our heart rate's going to stop, our respiratory rate's going to stop, and we're always going to be balancing. Our body always wants to stay at a homeostasis level, and it tries to stay under control by monitoring all these aspects, and it's going to fix it as they come across. Big aspect is going to be these baroreceptors that are throughout the body. They're going to monitor where we're at, and it's going to monitor our pressure. It's going to monitor how everything's going to do in our back pressure on that. So these are going to give part of our autonomic system feedback to determine what we need to do and how to keep those bodies regulated and at homeostasis and that normal pressure. And as the pressures drop, our body is basically going to take care of itself. Our body's been taking care of itself for years and years before there was medicine out there, so it does a great job of trying to maintain itself. So same thing as when the body has low blood pressure and needs to increase, same thing when the body has got a high blood pressure, the body is going to go into those same type of things to decrease it. It's going to go the exact opposite. It's going to cause other areas of vasodilation and decreasing aspects. It's going to work to inhibit the system to try and decrease cardiac output. So all these different things of your body continually working itself to come out. Besides the baroreceptors that are out there, there's chemoreceptors as well. These are also going to be out and throughout the arteries and veins, and what they're going to do is they're going to respond to changes of carbon dioxide, oxygen, and pH. So are we becoming acidotic? Do we have too much CO2 in the bloodstream? So our COPDers and that don't have a lot of oxygen, but they're operating more with more carbon dioxide. So all these sensors are going to be out there. Main areas that we're going to be seeing these, the carotid bodies, the aortic bodies, and they're going to be monitoring. Those are big two things besides the baroreceptors. So the chemoreceptors and the baroreceptors are what's going to keep that body monitoring all the aspects, checking where everything are. If they see decreased levels or increased levels, they're going to be stimulated, and again, they're going to act on the brain. They're going to act directly onto the heart itself and get that feedback, and they're going to work on the endocrine system, so the body is completely balancing itself out. Other aspects we're going to see is, when we talked about the kidney before, is it's going to also act on the endocrine system to release renin, angiotensin, ADH, aldosterone, all things that we'll talk about when we get more into that urinary system and that regulation later, that stimulates the control of blood pressure, what's being diffused in the kidney, what's being retained, and all those things are going to work together to maintain itself. So our job is to figure out what's going on when we do see these issues, and how can we help control that and fix that a little bit faster and stabilize those patients. So those are the big aspects that I really want you to know. As we talk about the blood vessels themselves, again, I want you to know the flow of blood. So if I start off at one point in time, where does that blood flow? So not only going from the systemic circuit, which I said, which is basically your arteries and veins out in the body in the systemic system, but once it does drop into the heart, what's the flow in the heart and where does it go? So if I had a drop of blood in my finger, starting out in the capillaries, it's going to go into the venules, it's going to go into the veins. From the veins, it's going to travel into larger veins. It's going to go up to the superior vena cava because it's coming up my arm and coming from above the heart down. Superior vena cava is going to dump into the right atrium. Once into the right atrium, that blood then is going to dump into the right ventricle through there's a valve, not the semilunar. It's 3 valves on the right side. See if you guys can remember what the valve is. Might be important for later. Going to go right down to the right ventricle. That right ventricle is going to contract, and it's going to go through the pulmonary artery. Pulmonary artery is the only artery that deoxygenated blood. Once there, it's going to go into small capillaries around the lungs near the alveoli. There's going to be gas exchange. It's going to be exchanging CO2 for oxygen. Then it's going to come out as oxygenated blood down the pulmonary vein. Pulmonary vein is going to dump right into the left atrium. Through the left atrium, it's going to go through the semilunar valves, let you guys know exactly which the name of here, down into the left ventricle. And in the left ventricle, that's going to contract and go out to the aorta. Now, once it goes out to the aorta does branch. It's going to go up to the top. It's going to then shoot out through smaller arteries. I'm talking about the subclavian arteries and the different branches. I'm not going to hold you too much responsibility right now, but it's going to go through smaller arteries down to arterioles and back to the capillary bed, which it started. So those are the type of things I want you to be able to answer and talk about that flow and know specifically this orientation and how that goes. That's going to be the big thing for this. Again, I'm not going to hold you responsible for knowing the right subclavian arteries and the femoral arteries and those type of things at this point in time. I just want you to know a basic flow. And that'll be the big components that we're dealing with. The other aspect is we have to know is we have the blood flow to the brain. Again, our biggest area, especially like when we're doing CPR and we want major flow, our biggest concern is blood flow to the heart and blood flow to the brain. Those are the areas that basically control our body and are the most important aspects. So we want to know exactly those flows, those pressures, and keeping that up. Once we get blood flow up into the brain, it basically goes through vertebral arteries that will expand in their small capillary beds, and they'll come out in venules as well. We'll talk about how those arteries work more when we're talking about intracranial pressure later, but all I just want you to know is, again, knowing that blood flow at this point in time. Specific arteries, areas like that, I'm not concerned about you knowing right now. That's basically about it. And same with the veins. I'm not going to have you know necessarily the names of the veins at this point in time, but I just want you to know how that process goes. As we look through here, we're going to talk about future when we're going through each of the organ systems, the blood flow to each of these organisms, both to and from, where it goes, how it rotates, what we're going to be from the important aspects of each of those. So that's where I'm going to leave that for now. Beyond that, that's going to be the most important aspect that I want you to know about the blood system. So I'm going to stop it right there. That'll answer plenty for the test. Hopefully it gives you some great information, a lot of room to expand. And as we get into more in-depth areas, we're going to spend a lot more time on each of these systems. So again, brief overview. Hope this was helpful. Look forward to seeing you soon and hope you're ready for the test.